तो कुछ टाइम बाकी है, स्टूडेंट है नहीं।
खाना खाएं?
नहीं खा के आए। थैंक यू। अभी रुक जाइए 5 मिनट, अराउंड 50 स्टूडेंट हो जाए तो। ओके, अब ऑन कर दीजिए। वैसे 1 मिनट है अभी, 1 मिनट रुक जाते हैं। Good afternoon, everyone. I am Dr. Sabha Amin Khan from the I am senior resident in biochemistry department, and I will be taking your today's practical session on estimation of serum protein, albumin and globulin ratio. Are you able to, all of you are able to hear me? And if you have any okay, and if you have any query, you can write in the chat box at any point of time, and you can also unmute yourself and ask. Okay, so objective of today's class is to enumerate and state the principle of various qualitative and quantitative method of estimation of protein, to understand the clinical significance of estimating plasma and serum protein, to estimate the total protein and the albumin in a given sample of serum, and in the end we will calculate the AG ratio and correlate these findings with relevant clinical condition. So first of all, before going directly into the topic, let's revise our knowledge about protein. So the protein, as you all must know, is a most abundant biological macromolecule, and it is involved in almost every biological process taking place in human body. For example, it acts as catalyst in biochemical reaction as enzyme and chemical messenger. Some of the hormone are protein in nature. Then in cell signaling, they are act as a receptor protein, and they transport biomolecules. So you name it, and the protein will be there in some form in performing a function of important function of the human body. So structurally they are the polymer of alpha amino acid linked end to end by peptide bond, and this is being all I think this is all being covered in your theory classes. So I want to know what do you understand by peptide bond. Please, anyone can answer what is the peptide bond. Okay. Okay, so I've got multiple responses. So yes, it is a amide bond which is formed between the amino group of one amino acid and carboxyl group of another amino acid by removal of water molecule, and this reaction require ATP. Okay, and in protein, the direction of protein is start from the N terminal, amino terminal, and end with the peptide terminal. So a very short chain peptide up till 10 amino acid residue is called oligopeptide. Up till 50 amino acid we say it polypeptide, and when the amino acid residue increases more than 50, then we say that the polypeptide is known as protein. So here I want to ask one more question from you all. So if we say protein is a tripeptide, then what does this tripeptide denote? Whether it tell the 3 peptide bond present in this or the 3 amino acid residue. Okay. Okay, it's 3 amino acid residue that is denoted by tripeptide, not triple peptide bond. For example, glutathione is a tripeptide which is consisting of 3 amino acids, glutamine, cysteine and glycine. Similarly, vasopressin and oxytocin are oligopeptide having 9 amino acid residue, so they are nonopeptides. Now coming to the structural organization of protein, the primary structure of the protein tell you about the total number of amino acid present, types or composition of amino acid, and even their sequence or order of amino acid in a chain with its N and C terminal amino acid. So all this information is being predetermined by the genetic code. All this information is already there. Even any special biological property and even the folding of the 3-dimensional structure, this is also being predetermined by the genetic codes. It's all there in the DNA. So in the secondary structure, which is basically the folding of the segment of protein with the help of hydrogen bond in most of the cases, and the classical example is alpha helix and beta pleated structure. These are the secondary structure, and when these secondary structures in a protein come together and make a complex 3-dimensional structure with multiple folding and interaction of different type of interaction like hydrophobic interaction and van der Waals forces and ionic interaction as electrostatic linkages, even disulfide bond occasionally and hydrogen bond, all these together make a 3-dimensional structure of the protein, which is a most stable form of protein, and it is required for the biological activity of the protein. So if the 3-dimensional structure, that is the tertiary structure of the protein, is lost, then its biological activity is also lost, as in the case of denaturation. And finally, the quaternary structure is when the protein is made up of multiple units, more than one unit, then it is called then that whole together is called the quaternary structure. So the subunit can be identical or leading to homologous protein, and can be heterogeneous. If non-identical subunit are there, then heterogeneous protein it is called. So please give me the example of quaternary protein. Okay. Yeah, hemoglobin is a very good example of quaternary structure. Okay. So when we draw the whole blood and centrifuge in the presence of anticoagulant at a high speed, we get 3 fractions. The topmost clear liquid, which is called plasma, and it is about 55%. Then middle narrow band that is whitish in color, it is called buffy coat, and it constitutes less than 1% of the total. And in the lower part we get 45% solid part, that is mostly composed of red blood cell, and it's called hematocrit. So basically the 3 part, the topmost part is plasma, which is mostly fluid having more than 90% of water and almost 8 to 9% of solid constituent. And in solid constituent we have protein, different biomolecules and enzymes and hormone, etc. These are all present, all the part of plasma. and then in the second part, which is a very narrow band in the middle, is buffy coat, and it is rich in WBCs and platelets, and this is used for DNA analysis because WBCs are nucleated, and we can use them for getting DNA analysis. And the lowest part is, like I told you, is packed with red blood cell. But in laboratories, instead of plasma, we prefer to use serum for the biochemical analysis. Why so? We will go into it. First of all, what is the difference between plasma and serum? So when we directly centrifuge the whole blood with anticoagulant, what we get as a supernatant is called plasma, and it is and it contains all the plasma protein along with fibrinogen. While when we do centrifugation after coagulation of blood, as there is no anticoagulant present in the tube, then the supernatant that we get is called serum, and in this the fibrinogen is absent, and so we can say the serum is plasma minus clotting factor. Okay, so why we prefer serum? Because it do not have fibrinogen part, which is almost 4% of the protein, plasma protein are there in the plasma, and fibrinogen is one of the important part, and it provide viscosity. It's a large protein, elliptical in shape, and it's provide viscosity to the plasma. So when we remove this fibrinogen, as it is used up in coagulation, so this provide serum a clear fluid nature, which do not interfere while chemical analysis going place in laboratories for analysis of different parameter in the serum. And also it do not have anticoagulant, which sometime interfere with analysis. So these are the two major advantage of using serum instead of plasma. So here I want to in your previous, I think in your first practical class, you have learned about this vacutainers having different type of anticoagulant, and there is color coding of their caps. So by seeing the color, we can identify which type of anticoagulant is present in the vacutainer. So here I want to ask you one by one which type of anticoagulant is present in each tube. For example, in the blue, what is the anticoagulant present? No. No one has given answer until now. No. In the blue capped, this one. Yes, sodium citrate is present in the blue vial. And in the red vial, which is written as plain vial, none. Okay, it do not contain any anticoagulant, so the blood when draw in this vacutainer, it will coagulate, and when we centrifuge, we will get serum. So in this lavender color vacutainer, what is the anticoagulant? EDTA. Okay. Then comes this grey color vial, which is used for the estimation of glucose. Sodium fluoride is for another purpose, but what is the anticoagulant? It has sodium fluoride, but it is to inhibit the enzyme of glycolytic pathway, so that the cell do not take up glucose, and false reading will come if it get taken up in glycolytic pathway. So along with sodium fluoride, there is one more substance, or you can say chemical, is present for as an anticoagulant. Okay, it is potassium oxalate. So potassium oxalate is present as anticoagulant along with sodium fluoride. Now in the green colored vacutainer, Okay, heparin. So coming to the plasma protein are the protein that circulate in the plasma, okay, and they are mainly synthesized in the liver and then secreted into the plasma, and there are few part that is synthesized in the plasma cell, that is B lymphocyte, major immunoglobulin part, and also certain hormones that are protein in nature are synthesized by their respective endocrine glands. So when we say the protein present in the plasma, which is almost 7% of the solid constituent of the plasma, does it synonymous with the protein present in the blood? Can anyone pinpoint whether this statement is correct or not, that the plasma protein is synonymous with the protein present in the blood? Is it so? Okay, why? Okay, there are certain proteins like hemoglobin that is present in the RBC, so that is the part of blood, but that is not the part of the plasma. So the plasma protein are not synonymous with the protein present in the blood. So the major fraction of the plasma protein are made up of albumin, which is almost 60% of the total plasma protein. Then the globulin is a second major part, which constitute up to 35% of the total plasma protein. Then comes fibrinogen, that I already told you is approximately 4% of the total plasma protein, and the other protein are less than 1%, and in other protein comes the proteinaceous hormone, for example insulin, proinsulin, and luteinizing hormone, FSH, different type of hormone. Then there are certain enzyme present in the plasma, and certain regulatory protein that are present in the plasma. These are all proteinaceous in nature, and they are less than 1% of the total plasma protein. And like I already told you, the mainly the plasma protein are synthesized by the liver and then secreted into the plasma, except for immunoglobulin that are synthesized in the plasma cell, and these few hormones that are synthesized by their respective endocrine glands. Now these fractions of plasma protein are separated by various methods. For example, salting in and salting out, that is being already told to you, by using sodium salts and ammonium sulfate salts. Then the most commonly used technique other than this is serum protein electrophoresis, which I will discuss in later slides. And some other techniques are like ultracentrifugation, affinity chromatography, immunoprecipitation. These are other techniques for separating different fractions of the plasma protein. Why that is important? Because in certain diseases different protein are increased and decreased. So to analyze that thing and to diagnose the disease, and for the further management, we test the total protein in the sample, serum sample. Also we test the fraction of the plasma protein, which fraction of the plasma protein is increasing or decreasing. For that we use serum electrophoresis. So serum electrophoresis, like you have briefly told in your last lecture practical session, that it is the movement of the charged particle in electric field. Okay, so the positively charged molecule will move toward the negatively charged electrode, that is cathode, and the positively charged negatively charged particle will move toward the positive electrode, that is anode. And this electrophoretic mobility or the rate of movement of these charged particle is dependent upon their net charge and their shape and size, and the temperature of the reaction, electric field applied, and the buffer that we use in the medium, its pH, and also its composition and ionic strength. So all these factors are involved in the or affect the rate of movement of these charged particle in the medium. So when we do serum protein electrophoresis, means when we use protein for electrophoresis, what we do, we use a pH of very high pH. So at the very high pH, the protein become negatively charged particle and move toward anode, and we keep other factors constant. For example, we use constant temperature, constant ionic strength of buffer, constant voltage of electrode. So if we keep all the other factor constant, then the movement of protein in the electric field will only dependent on their net charge by mass ratio. Okay, so on that basis we do the electrophoresis of serum, and we use in most of the cases we use cellulose acetate and agarose gel as a support medium on which we apply our serum, and when we put it in the chamber like it's shown in the figure B, this electrophoretic chamber which have buffer of pH 8.6 and the electric voltage is applied, then the protein having net charge of net negative charge will move toward the anode, that is positive charge electrode, and their rate of movement is determined by their net charge by mass ratio. So at the end of this we get this picture as it's shown in figure C, in which the albumin has moved farthest, followed by alpha 1 fraction of globulin, then followed by alpha 2, then beta fraction and gamma fraction. So this is the normal pattern of serum protein electrophoresis, and when this is the simple visualization of this support media after staining it, and we can also put it quantify it by using scanning densitometer, and we get the picture of electrophoretogram, which is shown by picture D, where you can see that the different width of their protein fraction is dependent upon their concentration in the plasma. So we can determine the concentration in plasma by scanning densitometer, by electrophoretogram. So I have also put the other two pictures in which you can see the normal pattern and the abnormal pattern. So in the normal pattern we see albumin, that is maximum, followed by alpha 1, alpha 2, beta 1, beta 2 fraction, then gamma fraction. So but in this picture you can see there is a spike in the gamma region, which is because of increase in gamma globulin, and this spike in the gamma region is also known as M band, which is dark band. There is no band here in the gamma globulin region, but here you can see a dark band here, which denotes the increase or spike in the gamma region, which is because of monoclonal immunoglobulin, as in the case of plasma cell cancer, multiple myeloma. So the whole purpose of doing the serum protein electrophoresis is to know which fraction of the protein is increasing or decreasing, so that we can pinpoint the pathology. This is also a agarose gel of normal agarose gel serum protein electrophoresis is being done, and this 1, 2, 3, 4, 5, 6, 7, these are the different sample of different patients. Okay, and this at the 7th position, or you can see this is the normal pattern denoting albumin, alpha 1, alpha 2 fraction, beta 1, beta 2 and gamma fraction, but in this 6th you can see there is band which is in the beta region. Now coming to the albumin, which is the most abundant plasma protein synthesized by the liver, and it has a single polypeptide of 585 amino acid and molecular weight of 66 kilodalton. Since it has a very high number of charged amino acid in its chain, they increases its solubility, and they also the albumin have net negative charge at physiological pH of 7.4, having the plasma half-life of 15 to 19 days, and finally it catabolized by pinocytosis followed by lysosomal degradation. So here I want to tell you about serum fructosamine, which is a glycated form of plasma protein, and glycated albumin is a major component of serum fructosamine. So I think in your theory classes you are being told about glycated hemoglobin. So glycated hemoglobin is seen in the patient of diabetes, where in diabetes mellitus what happened, the serum glucose level in the plasma is very high, leading to the non-enzymatic glycation of the various protein present in the blood, and that will lead to glycation of hemoglobin as well as glycation of the plasma protein. So since the lifespan of the RBCs is 120 days, so by measuring the glycated hemoglobin we can know the average value of serum glucose in the plasma for around 3 months. Okay, so in the case, so if we see that this glycated hemoglobin is higher for some patient, that means that his serum glucose level were very high for last 3 months. Okay, that means either he is not taking the drug properly, or if he is taking the drug, then it's not effective, so we have to change the drug. Similarly, the serum fructosamine and having that are the glycated plasma protein, and of which glycated albumin is a major component. So by measuring the glycated albumin, we can also tell the serum average value of serum glucose in the plasma for around 1 month, because the half-life of albumin is around 15 to 19 days. So by measuring the glycated albumin, we can tell the average value of serum glucose for past 1 month. So what is the major function of albumin? First and the most important function is to maintain the plasma oncotic pressure. Okay, then act as transporter. It act as a transporter for various molecule, for example steroid hormone, unconjugated bilirubin, fatty acid, calcium ion, magnesium ion, and various drugs. I have mentioned two drugs only, penicillin and sulfonamide, but it is the carrier, act as carrier for large number of drugs. Then it is also a negative acute phase reactant. Okay, so this might be a new term for you all. The negative acute phase reactant are the protein. First of all, the acute phase reactant are certain protein that increases or decreases during the inflammatory process. So inflammatory process is is seen in the case when the body is having certain infection, or yes, it reduces the it do not reduces the inflammation. Okay, it just get reduced, its synthesis get reduced in the case when the body is having inflammation, as in the case of certain infection, acute and chronic, and in neoplasm and in autoimmune diseases. In all these conditions, body has a inflammatory response, or body is in inflammatory state, and in this state there are certain protein that increases and there are certain protein that decreases. So the protein that increases in the case of inflammatory state of body are called positive acute phase reactant. For example, C-reactive protein and various other globulin are example of positive acute phase reactant. And negative acute phase reactant, the albumin is the most important example. Other example is transthyretin and beta transferrin. These are two other negative acute phase protein that decreases when there is when the body is in inflammatory state. And body is in inflammatory state when it is in certain stress or infection, or when it is suffering autoimmune diseases or neoplasm. Then in all these conditions, body is in inflammatory state. You will get to know more about what is inflammation in your physiology class. And also it this plasma protein act as buffer in the plasma. Now the globulins are the heterogeneous family of protein. They are okay. Why the albumin is reduced during inflammation? So what happens during inflammation? The function of the body is getting affected, and so its synthesis in the liver is decreased. That is why the albumin is decreased in infections. And also the catabolism is also increased during infection and trauma. That will also lead in the decrease in the albumin. Okay, globulin they are less water soluble than albumin, and they have the globulin have different fraction: alpha fraction, beta fraction, and gamma fraction, and each fraction has number of protein in it, and I have mentioned only a few select example here. So for example, in alpha 1 fraction we have alpha 1 antitrypsin, alpha 1 acid glycoprotein, alpha 1 phytoprotein, but these three are not the only example. There are multiple example. I have only mentioned here very few important selected examples. Similarly, in the alpha 2 we have haptoglobulin, alpha 2 macroglobulin and ceruloplasmin, and in beta 1 fraction we have transferrin, C4, which is a complement protein, and LDL, low density lipoprotein. They are the carrier for cholesterol. And then beta 2 fraction C3, which is also a complement protein, beta 2 microglobulin. And in the gamma fraction we have immunoglobulins and C-reactive protein. Like I told you, C-reactive protein is an example of positive acute phase reactant, the protein that increases in the case of inflammation. Now the reference level of protein in the serum, the total protein ranges between 6.7 to 8.6. So in the normal person, the protein level varies from 6.7 to 8.6. Okay, albumin value range from 3.5 to 5.0 gram per dl, and globulins is range from 2.0 to 3.5 gram per dl, and Ag ratio for the normal person is 1.5 to 2.5. It should be between 1.5 to 2.5. So what is a condition of hyperproteinemia? When the plasma protein level, total serum or plasma protein level go lower below 6.7 gram per dl, then this condition is hyperproteinemia. So if it is because of decrease in albumin fraction, that will lead to the decreased albumin by globulin ratio, and this decrease in albumin may be because of decreased synthesis, as in case of chronic malnutrition, malabsorption and chronic liver diseases. In chronic malnutrition and malabsorption, the body is not able to take protein is less in the diet, or body is not able to absorb protein that is being taken in the diet. So there is less amino acid available for the synthesis of protein in the liver. And in the chronic liver diseases, what happens, the hepatocyte function is destroyed, so the proper normal synthesis of protein is albumin is not being able to synthesize. Similarly, there might be increased loss which are seen in the cases of renal disorder, for example nephrotic syndrome, and severe burn and infection, which this is a state of increased catabolism of protein, so leading to hyperproteinemia. And the other part where the Ag ratio is increased is because the globulin fraction is decreased. So in the case of gamma globulinemia and hypogamma globulinemia, where the gamma globulin level are decreased, we see the hyperproteinemia with increased Ag ratio. Now the hyperproteinemia is the state where the total protein concentration in the plasma is increased. With normal Ag ratio, it is you can see in the relative hyperproteinemia. What happened in the relative hyperproteinemia, the total amount of plasma protein is same, but since the plasma volume is decreased, leading to the lower concentration of plasma protein. So amount of plasma protein is normal, but since the plasma volume is low, that will lead to the decrease in the concentration of the plasma protein, and it is seen in the condition of dehydration. Dehydration, as you can see in excessive sweating or excessive vomiting, diarrhea. In all these conditions, diabetic ketoacidosis, dehydration is seen, leading to the relative hyperproteinemia. And with decreased Ag ratio, when we see the very high increase in the globulin, as in seen in the chronic infection, where multiple type of immunoglobulin are being increased, and malignant proliferation of plasma protein, where a single type of immunoglobulin increases, leading to monoclonal immunoglobulin rise, as seen in the case of multiple myeloma, which is a cancer condition of the plasma cell. Now how are we going to estimate the plasma in a certain sample? For this we have qualitative estimation and quantitative estimation. In qualitative estimation we only see whether there is presence or absence of protein, and in quantitative estimation we quantify or we measure the value of protein in the given sample. For example, heat coagulation test is a qualitative test where you can see the coagulation of or precipitation of protein, and if there is precipitation you can say okay, the protein is present. What we do in this, we fill the test tube, more than half of the test tube with the urine, and then we heat the upper 1/3 of the sample and look for any turbidity in the upper part of the test tube, and the lower part will act as a control from where you can compare, and then you will add 2 drop of 33% acetic acid, which will acidify the media, because in alkaline medium even phosphate give precipitate which is also white in color, and that will be a false positive. So acidification is necessary, because in so if the this white precipitate is because of phosphate, it will disappear on adding 2 drop of 33% acetic acid, and if it remains, then that means the protein is present in the sample. Okay, so this is a picture showing the heat coagulation test. Okay, the urine that is seen here is slightly pinkish, which is not the normal color. Okay, so this is the only picture that I got. So in the second you can see the test is positive because white color coagulum or precipitate is present in the upper part of the test tube. Okay, the second is ninhydrin reaction, which is given by free amino acid. So amino acid are oxidatively deaminated into carbon dioxide, ammonia and aldehyde when heated with ninhydrin. So reaction is given like amino acid with ninhydrin will give carbon dioxide, aldehyde and ammonia. This is oxidative deamination, and ninhydrin get reduced. Now this reduced ninhydrin react with the ammonia with another molecule of ninhydrin, forming the complex compound, which is also known as Ruheman purple, because this is purple color compound. So if the solution give this purple color, that means the protein is present. Okay, and this is negative. But why we are saying okay, why we are testing proteinuria here? Because these are just a general test for the protein, and this test can also give positive in ninhydrin test can also give positive in serum. Okay, and this heat coagulation test can also it can be modified. No, it do not precipitate because we only heating the upper part. Okay, we are only slightly heating the upper part of the test tube, so it won't it coagulate and it won't go down. Okay, so this yellow color is also positive, which is given by proline, which is we add acetic acid because it will acidify the medium, and if the turbidity or the white color is because of phosphate, that will disappear, because phosphate will only precipitate in alkaline medium and it will disappear in acidic medium. Positive ninhydrin shows free. Yes, free amino acid, wherever free amino acid is present or ammonia is present, the ninhydrin test will be positive. That is one of the major disadvantage of this test. Now coming to the quantitative test of protein. So the quantitative estimation of protein that are based on copper reduction, for example Biuret test, Lowry assay and BCA bisynchronic acid assay, then UV absorption and dye based assay, for example Bradford assay. So UV spectrophotometry is also can be used for the estimation of protein, and it is based on the intrinsic UV absorption of protein. So what happened, protein can absorb UV rays of certain wavelength. Most commonly it has maximum absorption at 280 nanometer, and this UV spectrometry is mostly used for pure protein, and it cannot be used for the mixture of protein, because the protein concentration is given by this absorbance at lambda max of 280 nanometer. Okay, and it is compared with the using the standard of known concentration. So it can this method cannot be applied for the mixture of protein. Now the copper reduction method, the most common example is biuret method, which is based on biuret reaction. So what is biuret reaction? When the urea molecule is heated at 180 degree, it condenses into a compound which is called biuret, having 2 amide bond, and this in the presence of cupric ion form a copper complex which is purple or violet colored, having lambda max at 540 nanometer. So using this similar based on this reaction, this biuret method is developed, in which the peptide bond having amide linkage form a copper complex which is also purple colored, and this presence of purple colored compound will tell you the presence of protein, and by estimating the color is dependent, intensity of the color is dependent upon the concentration of the protein in the sample. So as the intensity increases, as the concentration increases, the intensity of the color will also increases, and which can be quantified by colorimeter. Okay, in the last we have considered the yellow colored as positive, because it is given by proline, which is a amino acid, not a amino acid. Okay, so this ninhydrin test is very specifically give different color, that is yellow colored, when proline is present. Okay, the concentration of the protein in the solution will be directly proportional to the intensity of this purple color compound, which can be measured by colorimeter. Okay, so that in that way we can quantify the concentration of protein in a given sample. So biuret reagent is a misnomer. Okay, it is based on a biuret reaction, but biuret is nowhere there present in the reagent. Okay, so always be careful about that. Biuret is not present, it is a misnomer, because the reaction is similar as given by biuret, okay, which is a condensed form compound of urea. So biuret reagent itself contains sodium hydroxide, which provide an alkaline media, copper sulfate, which provide your cupric ion, and then potassium iodide, which act as antioxidant, then sodium potassium tartrate, which act as chelating agent and stabilizes the cupric ion. So all these reagents are present in the biuret reagent, and the sensitivity of this test is 1 milligram per dl, which is good for serum, good for estimating serum protein. The next copper based method is Lowry method, which is very sensitive because it combines the biuret reaction along with Folin CO-Cal2 reagent, which is the mixture of phosphomolybdic and phosphotungstic acid. So what happened in this, that first of all, like in biuret reaction, the sodium hydroxide is providing alkaline medium, copper sulfate provide cupric ion, then potassium iodide act as antioxidant, and sodium potassium tartrate chelate. This is all being mentioned in your practical manual, I think. Sensitivity of test is, in simple word, it will if the concentration of protein is below 1 milligram per ml, then this test will not be able to accurately quantify the this concentration, so it will give wrong values. Okay, up to 1 milligram per ml, this test will hold good, means it will give the accurate result. The the Lowry method, like I said, is a combination of biuret along with Folin CO-Cal2 reagent, which is a mixture of phosphomolybdic and phosphotungstic acid. So in this, like in biuret reaction, first of all, the peptide bond in the protein will combine, actually reduce the cupric ion into cuprous ion, and now this cuprous ion having complexed with protein reduces this Folin reagent, which is the, like I told you, mixture of phosphomolybdic and phosphotungstic acid, into a blue color compound. Okay, so first the protein is reducing this cupric ion into cuprous ion and making a complex, and now this complex is again reducing this Folin reagent and giving blue color compound, which give absorption maxima at 750 nanometer, and this is much sensitive than biuret. Then the next method is BCA assay, which is bisynchronic acid reagent. Okay, so in this also the copper is reduced by protein, and this cupric ion, this cuprous ion will react with two molecules of bisynchronic acid and form a complex compound, which is purple in color and have lambda maximum, that is absorption maximum, at wavelength 570 nanometer, and this is very, very sensitive. Like you see, it can give result accurately till 0.5 microgram of protein per ml. If the protein concentration is even in microgram, this test will give accurate result. Now this is the dye based method. The dye being used here is called Bradford reagent, which is Comasi Brilliant Blue G250. Okay, so this dye exists in three forms. One is anionic form, one is cationic form, and one is neutral form. So the cationic form or protonated form of this dye is red in color and exists in acidic pH, while the neutral form, that is green in color, and then finally the blue colored unprotonated form having blue color is stable form. So in this dye, the protein, when combined with this Bradford reagent, which is unstable form, will convert into the stable form, that is unprotonated form, which is blue in color, and there is shift of the absorbent maxima from acidic form. In the acidic form, it has lambda max of 470, and in unprotonated or anionic form, it has lambda max at 595. So you can see the as the protein is being combined with this dye, the color change from red to blue, and the intensity of blue color is directly proportional to the amount of protein present in the mixture. Okay, is this method being clear to you all? I can repeat it. The dye, the Bradford reagent, that is a dye Comasi Brilliant Blue G250, which exists in three different forms: the cationic form or protonated form in acidic medium, and it is unstable, and neutral form, which exists, which is green in color, and then the anionic form or unprotonated form also, which is blue in color and is more stable as compared to red form. So when the protein come together, so initially what happened, this red form of dye or unstable form of dye donates electron and change the native structure of the protein. When the native structure of the protein is disrupted, the hydrophobic pocket of the protein are exposed, and the sulfonic group that are present here, the sulfonic group of the dye bind with the basic side chain of the protein and form the electrostatic linkages, and then it will convert into anionic form, that is blue colored form, and you can detect the change of color from red to blue, and the intensity of blue color will give you the concentration of the protein present in the mixture or a sample. So now the method for estimation of albumin. Albumin can be estimated by using bromocresol green method, in which the bromocresol green reagent is negatively charged at pH of 4.3 and the isoelectric point of albumin is 4.7. So if we use the pH less than 4.7, the albumin will exist in the positive form, which will react with negative charged BCG reagent and form a BCG albumin complex, which is green in color and have absorption maxima at 670 nanometer, and the intensity of the color will be proportional to the concentration of albumin. Okay, now what are the in this table I have shown the optimum method that will be used for estimating protein in different sample. So in the serum sample which has high concentration of protein, biuret test is very simply can give you the accurate result of total protein present in the serum. Okay, in the urine, if you want to check qualitatively, you will use heat coagulation test simply by heating the urine, and if it coagulate, you can say the protein is present in urine sample. And if you have to quantify, you have to use turbidity metric method. Okay, so turbidity metric method is similar to the heat coagulation, but in this we use trichloroacetic acid or sulfosalicylic acid, which will precipitate the protein, and this is seen as turbidity, and this turbidity is measured by colorimeter or spectrophotometer, and absorption is like quantified, and we can quantify the protein in the sample. In the CSF, which is also having very low concentration of protein, this turbidity metry method is used. For the protein extracted by detergent, we use bisincononic acid. Okay, this is very sensitive method, will give you the protein concentration up till in microgram. Then Lowry method and Bradford assay. Then detection of albumin is done by bromocresol green, and okay, so BCG, that is bromocresol green method, is used for albumin, and bromocresol green reagent exists at is negatively charged at pH. Yes, CSF is collected by lumbar puncture. The BCG reagent is negatively charged at pH of 4.3, and isoelectric pH of albumin is 4.7. So when we use the pH below 4.7, the albumin will exist as a having net charge of positive. So albumin have net positive charge at pH of 4.3, and BCG has negative charge, so there will be negative positive interaction, and the complex will form, which will give you lambda max at 670. Okay, is this clear? If anybody has any doubt, please write. Okay, so in the last, detection of the serum protein fraction, we do it by serum protein electrophoresis and or by immunodetection methods. So now coming to the actual protein protocol. So biuret we use because the sensitivity of biuret is up till 1 milligram per ml, and the serum protein is usually in gram per dl, which will hold good. Like we have biuret has a simple test and also have can accurately determine the serum protein. That is why we use biuret test. So for total serum protein, okay, we use biuret test for here, and for estimating that by using colorimeter, we have to make 3 different test tube and label it as test, standard and blank. So in the test we will add serum which will have some amount of protein. For example, here we will add 0.1 ml of serum, and in the standard test tube we will use standard solution, which is the protein solution of protein of known concentration. So here we already know what is a yes.
Dr. Sabha,
yes ma'am.
Can you hear me?
Yes ma'am.
Here you have to tell that this is the practical. They might be doing it after some time once the COVID protocol is over. So this practical they have to perform later on. So they have to pay more attention to this. So what are the protocol to estimate total serum proteins? So how they will manage, how many tubes they will use? Just mention about it.
Okay ma'am. Okay, so this protocol, like ma'am said, you have to perform in the lab. So but right now since you are not performing, but still you have to pay attention, like for exam and all, you have to perform this test. So for measuring the serum total protein in a sample, we will take different test tubes, and I will show our video of that also. But before that, just know that we will use 3 test tube and label it as test, standard and blank. So here in the test we will add the serum that in which the protein is need to be tested. Okay, and there is this concentration volume of the serum that we will use is 0.1 ml. Similarly, in the standard test tube we will add a standard of known concentration of protein, that is the concentration of standard is 6 gram per dl, and we will add 0.1 ml of that solution in the standard, and in the blank we will use just distilled water. And finally then we will add biuret reagent in equal amount in each test tube, like 5 ml in the test and 5 ml in the standard and 5 ml in the blank test tube. Okay, then we will mix it and wait for 10 minutes as incubation period, and after that we will take the reading at 540 nanometer in the colorimeter. So here why we are using blank? We are using blank because it will because reagent will have some color of itself. Okay, so to balance or to know the intrinsic color of the reagent, we are using blank. Similarly, the protocol for the albumin. So you will take 3 different test tubes and you will label it as test, standard and blank again, and then you will in the test tube you will add serum which need to be tested, in which protein is need to be tested. You will take the 0.1 ml volume, and then standard in the standard test tube of 0.1 ml, and here the known concentration of standard is 4 gram per dl. Then in the third test tube, which is labeled as blank, you will add 0.1 ml of distilled water, double distilled water. Then you will use, for like I told you, for serum albumin we use bromocresol green. So you will add bromocresol green reagent of each 5 ml in each test tube, and here you will mix well and take the reading immediately at 670 nanometer. Why we have to take reading immediately? Because certain other positively charged protein can apart from albumin can also react with BCG solution, which will give you the false reading. So the albumin react immediately with the BCG, while other protein will take time, certain time for incubation time for give the color. So we have to take reading immediately so that we will estimate only the albumin part, not the other proteins. Then how we do the calculation? So in your first practical you are already being told about the principle of colorimeter. Okay, so colorimeter is based on the Beer's and Lambert law, and according to the Beer's law, the concentration of a substance is directly proportional to the absorbance, which is the amount of light being absorbed by the solution when light is passed through the colored solution. So the serum protein, based on that method, and Lambert law says that the concentration is also dependent upon the path length. So here what we do, we use the constant path length for each cuvette, and I will show you the cuvette in the video that I have made. Okay, so the path length, since path length is constant, so the concentration is only dependent upon the absorbance. So the serum total protein, the formula that we will use is the absorbance of the test divided by the absorbance of the standard of known concentration into the concentration of standard solution. Similarly, for the serum albumin, the absorbance of test divided by the absorbance of standard and into the concentration of standard that we have used. Finally, the serum globulin is serum total protein minus serum albumin, and then we can calculate AG ratio. Here there is a clinical case in which a 3-year-old male child was brought to the AIIMS pediatrics OPD by his parent with the chief complaint of generalized swelling of body for last 5 days. The swelling is started on the face, followed by the swelling on abdomen, and then the involved upper and lower limb. There is no significant history, past history and family history. On examination, the swelling was found to be painless and pitting, and the patient was suspected to have nephrotic syndrome, and the serum sample is provided to you. You have to estimate the serum total protein and AG ratio and interpret the result. So to estimate the AG ratio, you also have to estimate albumin. So here in this video I have shown how to estimate the serum total protein, which you have to do physically when you come to the lab. So please be attentive, and if you have any query, please ask. Okay, why it's not? Okay, I think this is not. Okay, all of you are, if you are able to see this video.
Yes, ma'am.
Okay. So in this, first of all, I have prepared a station in which I have kept all the thing that is being required. This is a test tube stand having 3 test tube for total protein and 3 test tube for albumin. Then I have biuret reagent here, then this double distilled water in this. Then this is a colorimeter. I will show you later this what colorimeter is look like. Then I have a pipette and with the pump attached to it, and then I have a micro pipette which is used for measuring a small amount. So first of I have labeled all these tests. First is blank, then this is standard, and the third one is labeled as test. Then I have to add 0.1 ml of test and distilled water. So distilled water I have taken in this test tube, and I will add 0.1 ml of distilled water in the blank, and then I will discard the tip and will add standard solution 0.1 ml in the standard. Then I will measure 0.1 ml of test solution, which is the serum sample of the patient, and put it in the third test tube, which is test, labeled as test. Now after that I will measure the 5 ml of biuret reagent. This is biuret reagent, which is blue in color. Since it is a colored liquid, while measuring we will look for the lower meniscus, and I am using here the non-blowout pipette. So in non-blowout pipette we have to measure up till the end. Okay, there is a label and we have to okay, so I am drawing the sample first. So I have similarly I have put reagent in all three of the test tubes. Okay, 5 ml in each, and then after the incubation of 10 minutes I have to measure the OD, or absorbance of the solution. So first of all we have to set the filter. So for this protein estimation, the lambda max is at 540 nanometer, means at 540 nanometer wavelength the absorbance is maximum. So I will set the filter. This is the filter, yeah, like I have set it 540, and then I have taken this blank solution into the cuvette. Cuvette is a small tube, glass tube. Okay, and it has the path length of 1 centimeter. Okay, so I have put this cuvette into the socket where we have to put the cuvette, and the reading will come onto the monitor, and I have put the reading as 0. Why I have put the reading as 0? Because this is the intrinsic color of the reagent itself. Okay, so so in the next standard we have added protein, so the intensity of the protein solution which obviously will be more than the color used in the blank, because in the blank we have used only the distilled water. So we have to negate the intensity of the color, intensity or the color of this biuret reagent itself. The color that is being given by the reagent itself has to be negated from the reaction mixture. Okay, so first I have taken the reading of the reagent, and then I have set it at the 0 by pushing this blank. So from when I will put, so when I next put this standard, it will automatically negate the intrinsic color of the reagent. So for each between each putting each solution, we have to clean our cuvette by double distilled water, and then wipe it off completely of any amount of water, so that our concentration of this solution will not be interfered. Okay, so I will clean it and then wipe off any liquid by using filter or tissue paper. Now I am taking the reading of, okay, you have to also note down this value. Okay, 0.16, this is the standard value for calculation. Okay, then again I will wash this cuvette with double distilled water and wipe it. This is the test solution, and I have poured it, and now I am measuring, and it is come out to be 0.14. So the reading here that we get is the optical density of the solution, and when the since the cuvette that we have used is same in all the three cases and it has a path length of 1, so the absorbance is now here is equivalent to the optical density. Okay, so we have done the whole experiment. Now we have taken the reading of a standard as 0.16 and test 0.14, and then we will do our calculation. Similarly, for estimation of serum albumin, we will use, again we will take the 3 test tube and label it as test, blank, standard and test. Okay, in the standard we put the solution of known concentration, and in test the concentration that we have to, the sample we have to measure. In the first blank I am adding 0.1 ml of double distilled water, then I will add standard solution into the standard test tube. And then finally adding protein sample, that is serum sample of the patient, into the third test tube labeled as test. Now I have to add the reagent bromocresol green. This is bromocresol green reagent, and similarly I have used a pump and a non-blowout pipette, and I will draw the sample and see the lower meniscus because it is also a colored liquid. Okay, so and then pour it into the blank while maintaining the, constantly looking for the lower meniscus. Okay, so I have pushed the liquid into the blank, and similarly I will do in other test tube. So here in the case of albumin we have to take the reading immediately after the test. So first of all, again I have to put the filter, where I will put the filter here, it has to be put at 670, but here since 670 is not there, so I have set it at 680 nanometer, which is closest to 670. So first I have taken this blank solution into our cuvette and then put it into the socket, and again certain reading is come, that is the optical density in the monitor, and I will push the blank button to set it as 0, because this is because of the intrinsic color of the reagent itself. Then I will wash the cuvette with the distilled water and wipe it. And now I am measuring the standard solution. So we have to clean it properly so that we get the proper reading. Now the standard reading is 0.31. We have to note it down. And finally I will take the reading of test solution. Which is 0.616. Okay, now we have to do the calculation. what you have written? Okay, absorbance and optical density, whatever is proportional to the concentration of chromosomes. Yes. Yes, we need to subtract the absorbance of the blank, but here we are not subtracting because we have already set it as blank 0 in the colorimeter itself, so it will do it for us. Okay, so we need not to subtract it. Okay. Okay, so optical density of the test in the total serum protein concentration is 0.16, and OD is 0. Of standard is 0.16. So OD of test divided by OD of blank in. Okay, what is the question is, I'm not able to see your questions. Blank in BCG is not. Okay, it is double distilled water with the reagent. So reagent itself has some color. Okay, so that color has to be subtracted, so that we get the true concentration, that is true color, the color that is being produced by the reagent, or the produced by the protein present in the solution, not by the reagent. Okay, BCG is added. Okay, BCG obviously is added to the all the test tubes. So the concentration of total protein is calculated by OD of test divided by OD of standard into the concentration of protein, that is 6 gram per dl. So we get the reading of 5.25, which is less than normal. So this patient is suffering from hypoproteinemia. And then for the serum albumin, OD of test divided by OD of standard into concentration of protein, which is 4 gram per dl. So the serum albumin of this patient is 2.10 gram per dl, which is hypoalbuminemia. Okay, so serum globulin is serum total protein minus albumin, which is 3.15 gram per dl, and the ratio here is 0.67. Okay, any doubt or any question, please ask. No, the double distilled water is used to remove the effect of absorbance by the reagent. Okay, reagent has some intrinsic color, so we will use this reagent with this.
We are adding double distilled water 0.1 to make the
whole volume. Yes, ma'am. Yes, ma'am. Yes, ma'am.
Okay, carry on.
Okay. So this is the case of hypoproteinemia with hypoalbuminemia with decreased AG ratio. This is the last slide, I think.
Yeah, that's right.
It's not moving.
So if anybody has any query, you can sort it out.
Ma'am, when we talked of electrophoresis, it was shown that the strip of proteins is placed in between the positive and negative side, and
yes,
you've seen that gamma globulin went to the negative side. So is gamma globulin positive in charge?
No. So all the protein at the pH buffer of 8.6 are negatively charged, but they will move on the basis of net charge by mass. So since the mass of GABA globulin is very high as compared to albumin, it won't be able to move much. Okay, so as compared to albumin, which is smaller and will move more toward the positive end. Okay, is it clear? Okay, do we assume that only protein are present in serum? Okay, if we are using here copper reduction method, so it is based on reduction, so any other reducing agent that are being present will also give this test positive. So that is a little disadvantage of this test, but since the amount of other reducing agent is not much, it will not affect our test to a great extent. A standard AG ratio is between 1.5 to 2.5. Okay. Any other query? Okay. Thank you all. और मैम ये इसका अपलोड भी करना होता है क्या, ये जो आज भी प्रेजेंटेशन दिया है?